It's okay.
Yeah, okay.
Super. So.
And I think let's get started if that's all right. Good afternoon, colleagues. It's an absolute pleasure to welcome Professor Thomas Zeltner to our departmental seminar series. He's going to be giving a lecture today titled Tobacco Control, How the Global Perspective Impacts National Policy Making. By way of introduction, Professor Zeltner is the former Secretary of Health of Switzerland and the Director General of the Swiss National Health Authority, and has a long history as an innovative leader in public health. He is the founder and first chairman of the World Health Organization Foundation, established in Geneva in 2020, which is a grant-making organization with the objective of addressing the most pressing global health challenges of tomorrow. He is a deputy chair of the University Council of the Medical University of Vienna and chairman of the board of Swiss Research Institute for Public Health and Addiction of the University of Zurich, and a member of the scientific advisory board of the Cape Heart Institute in the University of Cape Town. He has presided over changes to transform the Swiss healthcare model from one of regulated competition into a more value and consumer-driven healthcare system. Thomas, we very much look forward to hearing your thoughts today. Over to you.
Well, thank you so much. And it's such a pleasure to be here with you. I just said a few minutes ago, it would even be nicer to be with you in Cape Town, because I understand that you have a lovely spring starting, whereas here it's getting cool and fresh. And so more being in the sun would be lovely. Thank you for having me with you today. Actually, I don't dare changing my background. You see it's all blue. And if I move away, then you see a logo, and that's actually the WHO Foundation's logo. Just if ever you wonder what's happening here, this is what it is. What I want to do with you today is really to look a little bit into how has the perspective changed in national health policy making when it comes to tobacco control over the last few years, and how the global perspective is actually more or can more impact how we shape national policies. What I want to do today, and next slide please, is address 4 items briefly. And if I may say so, I choose them also a little bit because they are a kind of my interest currently, particularly starting with the first one, tobacco industry, how tobacco industry has actually become a global player. I think working in global health, working in health, in public health, is actually, if you don't understand the industry, which is so-called or your enemy, or where you want to find a new way of a new normal, then you need to understand this industry. Secondly, and I will be rather brief there, why is tobacco consumption a global health priority? Most of you are in the field of medicine, and I don't need to you talk too much about it. We all know the harms of tobacco consumption, and that will just be a couple of slides to show where we are right now with, with the damages. And finally, I will be talking about WHO and the global initiatives, and then how all of that comes together in national tobacco control policies and can come together. Next slide, please. You see here tobacco plants and down a package of tobacco product cigarettes. It's actually interesting, and I don't know how many of you have been looking into that. Tobacco has been used as a product, a smoking product, over 8,000 years in Mexico, in other Middle American countries. And again, interestingly enough, it has been used in rituals and in medical conditions, or to treat in these days as a health product. Tobacco then came over to Europe with Christoph Columbus. Next slide. And interestingly enough, it immediately became a very successful product, not only in the US, but also in Europe. And a huge number of people were smoking tobacco for a long time. And next slide, I go really quickly through that. You remember these days when tobacco and smoking tobacco was very fancy and very normal, and one didn't think too much about it, but it was just part of this post-World War II lifestyle, to be seen wherever with a cigarette or a cigar in the hands. First and foremost, males, of course, but women then came in and started smoking too. And unfortunately, we have to say the number of women smoking compared to the number of men who smoke is actually a sign of gender equality. In countries where gender equality is more or less reached, you have the same number of men and women smoking, hopefully low numbers. But if you look at the numbers in Sweden, in some other European countries where equality or gender equality is high, you will see that the number of smoking women is more or less the same than men. Not so in countries where that are much more male dominated. There often you have 50% of the male smoking and 5% of the women, or something like that. Next slide. You see here, and I think this number is quite interesting, the cigarette consumption starting really early in the 80s to 2000. And what you see is that up to 2009 or 2010, it was actually extremely rapidly growing market. And we will come back to that. Starting 2009, 2010, 11, you suddenly see that it flats down and actually decreases. It's not dramatically decreasing where we used to be in the 80s and 90s, and it is a pretty flat consumption pattern, but something happened between 2000 and 2010, 2015, 20, and we'll come back to that. Why do we see that? Next slide. You see, and I like this slide very much, it shows you the cigarette sales per adult in different countries. It's more or less all high-income countries. I didn't add and couldn't find a similar graph with South Africa on it. I will show you in a minute. But what you see is that this curve of sales, remember you probably something you have seen in other areas, namely it looks like an epidemic. It comes, has a top, and then flattens down again. And as a matter of fact, tobacco consumption follows in some ways the wave of an epidemic, and the epidemic is actually slowing down in Europe, in North America, is going still up in many other parts of the world. And that, of course, is a major concern to tobacco companies. Next slide. You see here the curve. I found that from South Africa, and you see a very similar picture in South Africa. It went up, and these figures start at 261, that you had at the top around the year 1990, and then consumption goes down and dramatically goes down. Congratulations for that. And you see at the same picture the retail price of cigarettes going up, and we will certainly come back to that, or I will come back to that. The price is certainly one of the determinants how much is smoked, probably the most important one. Next slide. What you see here, and that's original from Philip Morris. Of course, the companies saw that coming and were looking into strategies. How do we keep our business going? At the top, you see the sales of cigarettes going down from 915 billions to 625. And they started, of course, with a new business, as you know, which is the electronic cigarettes. And you see that the number of electronic cigarettes is sharply going up, compensating quite a bit for the loss of markets when it comes to cigarettes. Next slide. You see here, and that's another source, end stays for electronic nicotine devices. And you see, and that's a source from the WHO and from the OECD. You see that in many Western European countries, the number of inhaling tobacco products is going up and continues to go up. In other areas, and I will be very interested to hear your experience in African countries, it's actually still very slow and very low. But that's where tobacco companies hope and feel that their future market should be. Now, we will have to discuss, is that a good development or is that a fake good development? A little later, I will come back to that. Next slide. I can't go over that. Of course, tobacco is a big business, and you see here the stock and the price of the stock of Altria, which is the Philip Morris mother company, and you see it's actually going up and up constantly until 2017. I couldn't find a good graph later. It stabilizes after 17 also a little bit, but anyway, it's certainly a very profitable market, with Philip Morris alone selling $31 billion per year. Next slide. Given the fact that British American tobacco is the big one in South Africa, you see the very same is true for British American tobacco. You see here earning per share. And if you're not, you have no moral questions, as a matter of fact, and that shows the next slide, which is a scary one, is actually the performance of different industries in the US between 1900 and 2010. And whether you believe or not, the top runner is tobacco. So if you go to an investment company or bank, they even today may say one of the best products to invest in is tobacco or tobacco companies. And that only shows the power of these big companies. Next slide. As a matter of fact, and that's something we realized, it has become a monopoly market. I have not on it the Chinese tobacco, but three big giants, Philip Morris, Japanese tobacco, and British American tobacco are actually running the show these days. Huge companies. I'm a little ashamed to say all three of them have their international headquarters in Switzerland. The reasons why they are all in Switzerland has to do with our tax laws, has also to do with our good environment when it comes to companies and finding educated people to work here. And as you can see, they actually contributed with 6.3 billion US dollars a year to the Swiss economy, not employing too many people, but anyway. But what we see here is that from a very diverse industry, which had hundreds or thousands of companies, as we see it actually right now in the cannabis market, and I will come back to the cannabis market in a minute, the tobacco market is in the hands of very few companies these days. Next slide. And that brings me to, of course, the future of the tobacco industry. They themselves say they have actually three options, and they are working on the three of them. What Philip Morris is doing, and others also, is going into these electronic devices, electronic cigarettes, non-smoking cigarettes. Secondly, they are interested and are buying cannabis companies because they see that the cannabis may be the next tobacco epidemic. And then they, of course, know that there is still a big market in low and middle income countries. So most of the strategies of the companies is trying to keep cigarettes on the market in many low and middle income countries, to go into e-cigarettes and to start putting their feet into the cannabis market. Next slide. As you can remember and probably have seen, that Philip Morris even says they want to get out of cigarettes in the next couple of years. Whether they will do it or not is not sure. But anyway, we'll see whether cigarettes is actually a product that will be replaced by e-cigarettes and eventually cannabis, and they will continue, of course, with cigarette sales. Next slide. I will certainly want to go quickly through this. Why is reduction of tobacco consumption a global health priority? Next slide. You know, we realized more and more, and you know that there are negative side effects of smoking tobacco, particularly cancer and lung cancer, other cancers, heart diseases, etc. And one got more and more informed about that starting in the 60s, with epidemiological studies comparing smokers with non-smokers. And it took a long time to get the data correct. Next slide. And probably really landmark report came out by the Surgeon General of the US with Smoking and Health in '64, and in the US for the first time saying there are major health and public health problems with smoking. This was then followed, next slide, by a lot of debates within the US, and over that coming through to Europe and into the scientific community and the community of medical doctors, that cigars and cigarettes damage the heart. Given the fact that by then already this was a generally used product and smoked everywhere, it became, and it's the most deadly product if you look on a list of different products creating so much harm to humans. Next slide. The next question then was, does it only hurt patients or people smoking? And the answer is no. It took a long time to publish that. That is the IARC monography, tobacco smoke and involuntary smoking, passive smoking. This was published by the sub-unit of WHO. The tobacco industry tried to block that publication for many years. They had researchers working on it to show that the data were wrong. But at the end of the day, it was possible to show that yes, passive smoking is a danger for your health too. Next slide. And I just, for your knowledge, but you know that better than I do, that's from our world in data, you see the share of cancer deaths attributed to tobacco in 2019. And you can see here, you're actually not at the core. There are still countries with 30, 40, almost 50% of the deaths attributed to cancer deaths attributed to smoking. In South Africa, and you may know the latest data in 2019, it was 18%, going down considerably in the last 20 years from 28%. So congratulations on that. Next slide. This is a similar picture. I had difficulty understanding this. You see that now the death comes down in men, doesn't really go down in women. It's more or less stable over the last years from 96 to 2018. Maybe that we can discuss about that in our debate afterwards. Next slide. Another important factor of tobacco is, of course, that it creates addiction and dependence. And this is from Nuts, David, who compared actually all different addicting substances. And you can see that tobacco is actually creating a dependency or addiction who is as strong as methadone, cocaine, and is actually, when it comes to physical harm, very high on the list. Most people actually know this, and next slide, and know that it is very addictive. If you look at countries in Japan, if you ask smokers, 90% tell you, yes, I am addicted to it. In South Africa, I saw it's 74%. So nevertheless, the majority, no, not only that it is dangerous, but that they are addicted to it. Next slide. A big question is how addictive and how, in that respect, dangerous or positive are electronic cigarettes. And I mean, the question or the debate here is certainly not at the end. And we need, as a public health and the medical community, to look into that. I just cited here a couple of things. If you look at children and young adolescents, when they use electronic cigarettes, they're more than twice as likely to use conventional cigarettes earlier or later. So the hope that starting with smoke, with vaping, and then not going into smoking is a hope that hasn't realized, really. The question of how addictive are e-cigarettes compared to traditional cigarettes is still debated. In one paper in 2015, Ether found it's a slightly more addictive than cigarettes. But a newer paper from 2019 found that e-cigarettes are probably almost twice as addictive as regular cigarettes. So the question of how addictive they are, tendency is to say they're very addictive. And once you're in that addiction, it's very difficult to get rid of it or to change the attitude. That's the reason why in 2018, actually WHO, and that COP8 stands for working group of WHO, has defined heated products as part of the Framework Convention on Tobacco Control. I will come back to it and ask member states to control and to legislate on e-cigarettes as they should do for tobacco products. So having said all of that, let's move on to the next part of my intervention here, Global Initiative for Tobacco Control. I don't want to go through that with you. It's just something I have here in my presentation that you eventually later can go back through that and see where it started and where we ended. As a matter of fact, WHO expert committee already in '79 said tobacco is a very serious health threat. We had a resolution in '94. We had a resolution in '96, etc. But as a matter of fact, we have very, very many resolutions on health issues at the World Health Organization. Often we debate a lot on it in WHO, and at the end, you have a nice paper, but not too much is actually happening afterwards. And it took 98, next slide, to Gro Harlem Brundtland to become the Director General of WHO. And she actually is, we have to say, a hero in tobacco control, because she then decided we need to do more or less the same thing we have done in the past with other very addictive drugs, namely illicit drugs, where we have these international binding conventions. We have to have a tobacco convention established. And it took her a lot of guts to do that, because at the beginning, very many people were against having another international binding convention. And of course, tobacco industry was totally opposing and trying to intervene. Next slide, you see her here presenting that at the World Health Assembly in '98 when she was elected. Next slide. Before going into that, she actually asked me, I was at that time Secretary of Health, to look into how tobacco industry had tried or successfully tried to undermine tobacco control activities at WHO. If you look at strategies of WHO before '95, you will see that tobacco never has been a priority. And part of that has actually been a very, very sophisticated strategy established by tobacco companies. And in that respect, and we have to be aware of that, tobacco companies have actually 3 levels of activities. Level 1 is, of course, to do their core business. Level 2 is to lobby officially with member states, but also with other parts of industry. They are very strong in lobbying, interacting with advertising industry. They're very strong in many countries when it comes to restaurant and hotel industries, and having them as alliances. But apart from that, and they themselves say that in their papers, they do what, apart from the lobbying, which is almost a foreign policy where countries do, they have their secret services. And the secret services are trying to do a couple of things: establishing inappropriate relationship, meaning having people who worked or work for the tobacco industry being employees at WHO. What they even did in the early years, they came into the buildings of WHO and stole files in offices, because at that time there was no big control. They tried to influence other UN agencies that WHO doesn't have a strong anti-tobacco or tobacco control strategy, to discredit WHO officials, saying they are totally off the wall and they are ayatollahs, as they were called. And they did it not always themselves, but with surrogates, with research groups, with front groups, trade unions, etc. And they did, and that's very concerning, distort WHO research. We brought out this report in 2000 to show how much actually the past strategy of WHO or non-strategy of WHO has been influenced indirectly by tobacco control, by tobacco companies. And we needed to go over that in order to convince member states to adopt this convention. Next slide. Which was then the Framework Convention, and you see it in the left corner down there, which was at the end adopted in May 2003. And it took a couple of other months that 76 countries had actually ratified, so that by 27 of February 2005, it came into force. And you see at the top the impact that had on the global cigarette consumption per capita in the world. It goes down, and again, it's not something you need to read here and now and to understand, but obviously since WHO started to be much more severe on it, World Tobacco Day, resolutions, etc., you can see that the numbers are going down and that has an impact. Next slide. Now, what does that all mean for national control policies? And go just to the next slide, please. Here you see a very interesting, I think, a graph out of the British Medical Journal. FCTC stands for Framework Convention on Tobacco Control. And in the middle of the slide, you see the governments, be it the government of South Africa. You see that the Framework Convention has a couple of effects. It's a powerful legal language. The Framework Convention actually asks member states to become a member of the Framework Convention, and that normally means that they have to adopt their laws when it comes to sales to children, when it comes to tobacco advertising, etc. It has a social mobilization effect, a public awareness effect, and then again, a gender setting effect. And last but not least, it has an effect of pressure on the industry. And we have seen that, as a matter of fact, in many countries, that all these factors together make that when countries get member of the Framework Convention and adopt it within the country, then consumption is going down. Next slide. The WHO has actually helped in another way member states now to do that efficiently. And they came up with these empower logo, how should I say? Yeah, and it shows 6 avenues what you should do within a country. And luckily enough, most countries start doing that more. The most efficient way to reduce tobacco consumption, you know that, is raising taxes on tobacco, steadily going up and up, because that actually helps a lot. Enforcing bans on advertising, promoting and sponsoring, and warning on the danger of tobacco is very efficient to help going out of tobacco use, protect from passive smoking, and nevertheless also monitoring. And these are actually the technical instruments you need to look into and to try to implement in your country, be it South Africa, be it Switzerland. And we are not very good in all of that. Next slide. And we know, and we have good evidence that tobacco companies continue to try to influence poor nations' smoking law, trying to keep the process slow, talk to parliamentarians, etc., so that the implementation of tobacco laws in many countries is a very slow process. And we as a public health community should, of course, try to speed that up. I'm getting to the end very soon. Next slide. Mark Roberts, and I'm jumping here to a very other field, was from the Harvard School of Public Health, was actually looking, why do most health reforms fail? And they looked at more than 100 projects in different countries, and they came out with a model saying you need actually to be successful to master 3 processes. Next slide, or click just, yeah. You need to offer convincing scientific evidence. And that's what this Empower example and WHO gives you. You have finally the data you need to show that passive smoking has this and this effect on health in your country, that raising taxes has that and that effect. So the evidence is actually good. The evidence is not so good so far, and we have to work on that when it comes to e-cigarettes. The second process, and most people in the public health community are not so good in that. You need to understand and master the political process. How do you bring this evidence into politics and in your parliaments and even to your population? And the next one, you need to have an eye on the social values or societal values in your country. Going against the values is extremely difficult. Next slide. I just go quickly through understanding, mastering the political process. You know that. Next slide. Or just, you know, at the end of the day, you need 51% of your parliament to adopt the law. And we see in very many countries, it's actually right versus left. And at the end, if you want to be successful, also as medical doctors, you need to work on these 51% to get the process through. Next slide. For that, you need to be good in getting alliances and to see it's not enough to have the medical community on your side, but you need to have other communities sharing your concerns and coming in. The last, next slide, and congratulations on you. You need to look into opportunities. I was very amazed, and many of us, what South Africa has done when COVID came with, you know, the prohibition of tobacco sales, and you saw then the negative side effects again. But anyway, understanding that sometimes in history there is a window of opportunity where you can change things, and crises normally are these kind of things. And as a medical community, you need to understand and look into these political processes. And if you're not, then even the best arguments, scientific arguments, will fail. The last thing, and we made long time, I think, mistakes in that. We focused, next slide or next. Yeah, we focused a long time on smokers. We said product is bad, your smoking is bad for you, and smokers felt guilty, and creating that kind of guilty feelings is actually a difficult part. Many of them know that they are addicted, as you saw. And so we actually in Switzerland changed at some stage the strategy, next slide, and focused much more on non-smokers. We said nobody should be exposed to smoke. Children should not be exposed to smoke. They should be protected in the car, in the public transportation, but also whenever possible at home. And we saw that with that kind of changing societal values, not punishing, so to speak, smokers, but saying we all have a right to live in a healthy environment. Let's focus on non-smokers, has helped a lot in bringing the debate further down the road. So I think the conclusion is in all countries, we now have, because of the international efforts, because of the effort of WHO, the empowerment tools, the evidence and the mechanisms or the tools in hand, how we can argue. But we need in most countries to understand how the political processes are, where are they, how can we influence them, and finally to understand where is the value debate in your country. And if you have all these three three avenues together, you should be able to be part of a winning community, reducing tobacco consumption and bringing a lot of additional health to your population. Thank you. I'm at the end. Last slide. That's here. Discussion is open, and I hope that you enjoyed listening to that.
Thomas, thank you very much for that fantastic lecture. In the last 45 minutes, you've covered a lot of ground. I'm interested in asking Richard van Zyl-Smit, who has a strong interest in the impact of smoking on health, but also has been an advocate for reduction of tobacco use in our society, to provide some local context and comment. But before he does, I'd like to just ask a question. You've spoken to us about the WHO Framework Convention on Tobacco Smoking and the Empower endeavors. And despite most countries in the world signing up for these, their impact, particularly on big business, tobacco business, has been minimal. And I'm wondering if you can share some of your thoughts why these important policies have not been as impactful as one would have wished.
Yeah, I mean, and I was not sure, sometimes you had a little echo in it. I'm not sure whether I got all of your, we just need to confront realities. And one of the realities is that in tobacco, there is a huge amount of money. And the market is actually pretty easy for the for those who produce it, because it's such an addictive substance. So once you have, someone on your product, you normally keep them. And people and the tobacco companies know that. I mean, I don't know the data in South Africa, but in most countries, kids start smoking at the age of 14, 15, very early. And then they are addicted and they continue to smoke for a very long time. So their consumer market is actually very stable. Now the question you could raise is, should we make tobacco illegal and just prohibit it? And my definite answer is no, because we have seen the misery we create with illegal drugs. And as a matter of fact, the international conventions on tobacco, on illicit drugs need to be revised because more people in the global health community think a regulated market is probably still the better solution than a totally illicit criminal market with what you all know and see. So we think we need a regulated market for tobacco. We need a regulated market for cannabis. And that's the next big thing. And we need to look how can we organize that without falling into the traps of the past. And there, it's just a continuous work we have to do. When I was writing this report for WHO, we made a lot of recommendations, one of which was actually saying, please, member states, if you come to WHO, make transparent who is sitting on your delegations. Because we knew from a number of countries that tobacco industry representatives were on the delegation. And that's one of the problem you have in some African countries, because tobacco cultivation is a big business also. And some of your countries had a difficulty to accept that. But I think we need to find alternatives for them. And I think we will have to see how at the midterm tobacco industry is reducing their activities now. And we will have to see whether electronic cigarettes are a solution for them and for the public health community. Certainly they create less cancer, no doubt. But as we can see, many people actually change then the product. The last thing, and I said that in another intervention once, I think, to you, you need to be aware that you're somehow South Africa, the leading nation in sub-Saharan Africa. What you do in South Africa is then debated in many other of your colleagues in countries around. And I think in that perspective, if you succeed, it has an impact way bigger than just in South Africa.
Thanks, Thomas, for that very comprehensive response. I'd like to invite Richard to provide some local context. Richard, over to you.
Thanks, Ntobeko, and thanks, Prof. Zeltner, for an interesting discussion. I was at ERS and heard you talk about some of the Swiss interventions at ERS. So I think just to contextualize for the clinicians and just remember that, so I'm not a public health person and I'm not a tobacco policy person. I'm a clinician and dabble in policy and public health. And so there really are superbly strong policy and public health people in the university and in South Africa. The other thing that's quite odd about South Africa, and Prof. Zeltner alluded to it, is that we actually have remarkably strong, robust tobacco laws. And I somewhat facetiously make the comment to my international colleagues that whilst our government was denying that HIV existed, they were actually putting in very strong anti-tobacco laws. So we have got the National Tobacco Act from 1993 already, and the current bill is before Parliament to really tighten up the loopholes. So although we're a signatory to the FTCT, we have been somewhat remiss in in passing the legislation, and that currently is before government to bring us in line with the FTCT kind of principles of where and what, and also to regulate electronic cigarettes, which are unregulated currently. The other comment I thought I would just make in terms of tobacco consumption in South Africa, the Global Adult Tobacco Survey has just been released a couple of weeks ago. And we've seen, somewhat interestingly and still up for discussion as to why, that the tobacco consumption has gone up dramatically. So current estimates are 41% of men and 18% of women, which is up quite dramatically from 2016 and 2019. Also, just remember that depends where you are. So in Limpopo, it's 1.3% of women, and in the Western Cape, it's 25%. So there's a huge socioeconomic, demographic, regional variability. So as a country, we do remarkably well with our tobacco control. There's a lot of money flying around and lots of stuff going on in the background. One of the big challenges with our banning the sale is the import of illegal cigarettes. Mm-hmm. So we still provide vast amounts of cigarettes, usually provided by the tobacco companies themselves, and they complain that it's illegal, but actually it's still their cigarettes. But what it does is it negates the excise tax. So the government still pays for the healthcare, but doesn't get the tax. And so that's something that's a major problem, is that the revenue stream is dropped, and we do count heavily on tobacco, alcohol for our tax revenue. So I think, yeah, it's really interesting to get a global perspective. I think we can be quite proud of what we're doing, and it's all part of a package. The Empower package includes everyone. The politicians, the regulators, the public health, the clinicians all have to play a part, because just having a law doesn't help you stop someone smoking, and just helping someone stop smoking who gets to see the advertising and gets cheap cigarettes, it also doesn't work. So we need each part of that to play a role for us to be successful, but it's a long way off.
Thanks, Richard. There's a comment from Kirtan in the chat. I wonder, Kirtan, if you'd like to provide context and ask your question.
Yes, thank you. Just 1, 2, 3, if I can get my video working. Anyway, it doesn't matter. Can you hear me in Tobago?
Yes, very well.
Yes, yeah. Thank you.
Thanks. Thank you, Professor Zeltner. That was a very illuminating talk. I don't know if you heard about this, but we recently had our South African National TB Conference. And at the 11th hour, the WHO and some of its agencies and the Gates Foundation pulled out of this meeting. It was very disruptive, and a lot of people didn't attend because of that. And this was literally 2 days before the conference was going to start. And the organizers of this conference was an organization in South Africa, which is a medical training and educational organization. And they unwittingly accepted a grant from the Foundation for a Smoke-Free World. You must be familiar with them,
Sure.
that name.
Sure.
And this was for some unrelated project. You know, they have so many grants. And we actually had an incident several years ago where academics from this university also accepted grants unwittingly. And of course, they funded, you know, by Philip Morris, the largest cigarette manufacturer globally. And I was just wondering, you know, has this happened elsewhere? And, you know, how do we prevent such things from happening in the future? Is there some kind of global governance framework, or I don't know, you know, something that can alert people or prevent this kind of occurrence? Because it was very disruptive, and of course, not to mention very disruptive, embarrassing to the country and to the whole TB fraternity in the country.
Sure.
Thank you.
Yeah, I mean, it's a very good, very interesting point you're raising. I haven't heard that, but I can certainly come quickly back to, you know, the smoke-free, you know, initiative. you know, what comes to my mind is, you know, WHO was actually for a very long time, wondering how can we actually collaborate, what kind of money, what kind of support can we accept as a UN agency or a health organizations. And I, again, have the privilege that I have been working on that a lot. And the end product of that is something you can check on the homepage of WHO, is the FENSA, the framework of engagement with non-state actors. And what that does is it shows, and that could also be for you know, any organization, university, even in South Africa, looking into it. WHO actually found 3 groups where they needed to define how do we work together. The first one is the business sector. The second one is academia, and the third one is NGOs. And all of them have their own pros and cons. You know, WHO needs to work with the pharmaceutical company or with the pharmaceutical business, but it is very risky. Should WHO in one or the other way work with sugar industry, beverage industry, yes or no? And WHO actually decided that there are only 2 industries they do not collaborate. A is arms and weapons, and B is tobacco. And it makes sense to look into that because even if you collaborate, you need to be very careful what you do, because 2 things, it may be a real threat, but it may also be only a reputational problem. And you know, we in Switzerland often have the problem with a very different company sector, with Nestle, you may know, the biggest food producer. In what way can we collaborate with Nestle? And it's a very tricky question, because if you work with Nestle, it's for sure that you have 10 NGOs crying that is corruption, etc. So you need to find a way to navigate through that. At the WHO Foundation, we also just adopted a strategy with from what sector, under what conditions do we accept money. So you have to look into all of that, and eventually you find solutions. Now, coming very briefly, but I'm too long, sorry, to this foundation. And I don't know whether any one of you know Derek Yak, who is a South African. I still have, Derek Yak was a very good friend of mine, and I continue to have some contacts with him. He left actually this smoke-free initiative. My belief is that he believed that he can do something good, but the ideas or the views on him and why he did that are, very divided, I think. I stop here, and I see that you have the hand up.
Indeed, we'd like to invite one final question from Graham Matthews.
Thanks, Thomas, for such a broad-ranging lecture. I just wanted to ask, and you've alluded to this briefly, but so many of the tobacco control efforts seem to be on restricting the demand side. What about efforts on looking at the supply side? Do you think it's realistic to focus on reducing supply, and that it's feasible to try and reduce growth of tobacco in countries and restrict tobacco use by focusing on the supply side?
Yes, it does make sense. I mean, in few countries, shame on us always, Switzerland, you know, in Switzerland, actually, we had these machines where you can buy 24 hours a day, chocolate, some, you know, some daily products, but tobacco too. So it was very easy actually to get cigarettes 24 hours a day, and reducing access already by you know, not having automats selling tobacco makes sense. And we saw that if you actually close down shops at 10 o'clock until 7 o'clock in the morning, you have no chance to buy tobacco, it has an impact. You always have to be careful, and that's the same is true with prices, to be at the limit, not to have black markets starting. You know, that's always, if the price is too high, and someone alluded it, then importing non-tax cigarettes from somewhere and selling them in the corner somewhere, and for the police not being able to control that is the limit. So what you do not want is an established black market for cigarettes. And that again is then something you have to discuss with your law enforcement people, and how they can do that in different neighborhoods. I assume that's certainly more difficult in some areas in South Africa than in others, but you just do not want an established black market.
Thanks.
So Thomas, it remains for me to thank you again for this most engaging lecture and discussion. I found it very, very helpful, and I'm sure many did as well. Take good care, and I'm sure we'll be in touch soon. Thank you very much.
Well, thank you. And I just say, keep going. And as your colleague said, you're actually doing well, very well, compared to many other African countries. But just push and push and think of these political processes. How do you get them under control, and you will be a champion. Congrats. And looking so much forward coming down to Cape Town.
Brilliant. Take care, Thomas. Bye.
Thank you.